I'm Dr. Fiona Smith. I'm a GP in Eaglescliffe Medical Practice, and I also work as a GP lecturer for the medical school, and I'm involved in teaching all years of medical students. So my specialty is general practice, and my role is I work as a partner in the practice, and that's quite a varied role. Obviously, working as a day-to-day GP, which is doing surgeries and home visits, paperwork, actioning results, following up patients, and also working as a partner in a practice is like running your own small business, managing staff, managing new initiatives that are brought in, which may be changing every year. So it's kind of the basic running of the practice as well that you would be involved in. So it's a very varied and interesting role. Originally, when I left medical school, I wanted to do paediatrics. So I set out to do a year in paediatrics in hospital medicine, and during that time I realised that the things that would appeal to me about a job would be the freedom which you get with general practice, and the sort of more 9 to 5 kind of job, although the days are longer than 9 to 5 in general practice, but I didn't particularly enjoy working nights or weekends, so that's a really big appeal with general practice. And also the fact that although I enjoyed working with children, a lot of the children I saw in paediatrics were very poorly, and you were performing maybe invasive procedures on them, whereas I see I've managed to expand my role in terms of paediatrics within general practice, and I see a lot of well children and have a much more enjoyable experience in doing so. There's never a typical day at work. A lot of the thing that I enjoy about general practice is it is very, very unpredictable, so you don't get the opportunity to ever be bored with your job. A lot of what you see is what comes through the door, so you might be seeing a newborn baby 1 minute and then an elderly person the next. You might be seeing someone with acute appendicitis the next minute and then talking about someone's cholesterol in the next patient. So a typical day would involve, a full day would involve 2 surgeries. We usually have 17 appointments in each surgery. So I would come in and I would start my surgery either at 8:30 or 9 o'clock. And then in the middle of the day we have home visits for those patients that are housebound and can't make it to the surgery, so we would have time to do that, and then also time to action all our blood results and look at all the letters and correspondence from the hospitals before we then start the afternoon surgery, which again would be another 17 patients. So it's very, very varied, and there is the opportunity to have other special interests, which I do in terms of medical school, medical student teaching, which I thoroughly enjoy. And on those days, obviously there would be a change to my booked surgery where I may have an hour slot blocked to teach, do a tutorial with students, and then a shorter number of appointments so that I can see patients with students in with me and do some teaching at the same time. I think the variety is what appeals to me about the job, and the freedom as well, the freedom that I've had to explore other interests. So as well as teaching medical students, I've set up my own young person's health clinic, which has been running for 18 months now, and is thoroughly enjoyable. And I'm basically doing general practice within that clinic, but we're seeing 11 to 19-year-olds. One other thing about general practice that is really appealing is the multidisciplinary working, so you're working as part of a team, which I really love, and we've brought that into our young person's clinic. We've made it very much a multidisciplinary team, and we're working with other organisations like Youth Direction, youth workers, counsellors, CAMS therapists, and as part of that I think I've been allowed to have that freedom to pursue an interest and also make it work, which I'm really appreciative. So I think the variety that you see in general practice is the thing I enjoy the most. The challenges of the job are many, balanced with a lot of rewards as well. I think there's always a challenge with not knowing what's going to come in, and being ready to adapt to any situation. So, you could be calling an ambulance for someone who's driven their car to the practice, sat in the waiting room for a routine appointment and come in, and then you've discovered that they've got chest pain or they have sepsis, and you could be calling an ambulance for them and waiting for the ambulance with them. Or you could be going out to do a home visit on someone who's at the end of life. So I think it's the challenges of the broad variety of what we see, and being prepared even on a day where you may be feeling a bit tired, especially towards the end of the week, to still be there 100% for every patient that needs you. And it could be the last patient on a Friday night who comes in and tells you that they're thinking of committing suicide, and you have to be there 100%. So I think for me that is a challenge, and staying actually sharp and on top of all the changes in guidelines and NICE guidance, and knowing that you're doing the best job is also another challenge. So they're the main things. Opportunities to teach, I think, come about in other specialties, but I think you have a lot more freedom and time with the students in general practice, especially with the third year students, which I've been teaching for a good 12-13 years, that they come every week and you really get to know them, and you can have that personal relationship with the students. So in terms of general practice, I feel like that's a real benefit when it comes to teaching. And also being creative in a way, in that it has allowed me to pursue an idea that was personal, very, very personal to me. And I think in a bigger organisation like hospital medicine, it's much more difficult to innovate and to actually have your own personal idea and have someone willing to actually go along and produce a team and create a change is much more difficult in hospital medicine. So I think in a small GP surgery where you are running your own business, you have got freedom to make more choices and to influence your working day. I think that's worked really well for me. So my special interests have become teaching of medical students, supporting other practices in teaching in my GP lecturer role, and also my young person's clinic. I think there's huge scope for teaching in general practice, especially with Newcastle Medical School, because they've just redesigned their curriculum, and in their redesigned curriculum they're doing 50% more general practice. So GP teaching is first to fifth year and forms a really big part, whereas fourth year previously they only came to general practice if they specifically chose to do an SSE in general practice. They now are going to have a morning a week in general practice all the way through fourth year, and the third year attachment has increased to a full day a week from Christmas to May. So I think that is fantastic and will hopefully inspire more people to become GPs when they qualify, but also comes with its challenges. We obviously lose appointment slots for the GP that's involved in the teaching. And it does come with a lot of preparation. The tutorials have become more of a flipped classroom model, which includes a lot more preparation for the students and for the teacher. So it could be up to 2 or 3 hours of preparation for me the day before I teach. And that brings more challenges for me as well as a GP tutor, in that I'm supporting a lot of the other local practices who are teaching who might be finding that difficult. So I think the demands for general practice to be involved in teaching has increased, which is fantastic, but at the same time there is a bigger demand from patients for appointments and a lot less GPs around to deliver a quality service. So I think we just need to see what the future brings, but you would hope that the increased general practice for students will bring in more GPs, so eventually will help to ease the problem of recruitment. I would say if you like to have some independence and freedom, if you like variety, if you enjoy communicating with people and you're happy to see any age of person, then it's definitely worth looking at. And if you're interested in if you feel you have a special interest, for example, one of my colleagues has a special interest in dermatology, you can then go on to train to work in that specialty by doing any kind of postgraduate diploma, of which there are many, and you can actually do clinics both in the GP surgery and as a GP with a special interest within the hospital, which my colleague does. So, you know, if you feel like you've chosen a speciality and you like that speciality, but you would also like the freedom and variety of general practice, you should keep your special interest and bring it into general practice, is what I would say. And I think it makes the GP job more enjoyable, but also brings something to the practice, and you can work as a team where everybody has their area of expertise. I think to be a good GP, you always have to be a good listener. So I think the things that third years learn in general practice when they're attached in the practice, the basics of history taking, communication and good examination, differential diagnosis, all of that I think is key to a good GP. And I think they're the skills that you're using every day. I think having some innovation as well, having some creativity and innovation also helps, because you are often running a business, working with other people and needing to stay on top of things. And the third thing I would say is being a good team worker, because you're working as a team, and many of my team that I work with in my surgery I've worked with for 17 years, so you don't get as much changeover I think as you would in secondary care, and that's something that I really enjoy, but you do need to be a good team worker to sort of provide that expertise.